So, okay, there are different levels of what we call incontinence. And the one that I'm describing is stress urinary incontinence, meaning with stress, anything that increases intra-abdominal pressure, you'll have a leak, okay? The normal should just be a little stress, a little sneeze, a little cough. But if it's completely affecting quality of life, then we need to investigate further.
Hi, my name is Caroline Mutoko and I'm at Vivace Dermatology and Wellness Center. I came here because I was invited. Remember we did a poll that was completely and absolutely unapologetically targeted at women over 40. They said, come on over, let's talk. And the person who's gonna have that conversation with me is Dr. Natasha. For mom, dad, and your professor's sake, please give us all your titles.
My name is Dr. Natasha Odhiambo, medical doctor, aesthetic medicine, and one of the 3 doctors here at Vivace Dermatology and Wellness Center.
Fantastic.
Yes.
Now, you saw the poll, but I will run you through the poll.
Yes, we can.
Because once I did the poll, because I knew this conversation needed to be had.
Yes.
But everybody's always skirting around it. So the poll, the first one was, I went straight for the biggie. I said, have you ever leaked a little when you laugh, sneeze, cough, or jog? A very healthy 45% said yes.
As expected.
And then there was, the next one was a little. And then there were those who said no, and there were very few.
Yeah.
So help me understand, why do we leak?
So leaking comes as a result of weakness of your pelvic floor muscles. So what's happening is either with age, okay, or post-delivery, or just perimenopause, menopause, things are not as strong and as tight as they need to be to hold your bladder and the structures up. Okay. What this means is that the muscles hold your bladder up, okay, and they help you squeeze and hold or prevent the leak.
The leak,
okay?
yes.
So after, let's say, delivery, obviously you've had pressure. You've had a 3 kg, 3.5 kg pressure, yes, pressing on those muscles, okay? We deliver, yes, but it never really retains back its strength. What this means is, with stress, meaning with that little cough, with that little sneeze, you know, the muscle isn't as strong to hold what we call the urethra, and we get a little, just a little trickle leak, just a little, and that's what happens.
I understand, and I remember there's a woman who DM'd me and told me, Caroline, why are you calling it a leak? Maybe there are things I cannot do, like gym is out, jogging. So why that? I can understand if you say cough, I can feel what you're talking about, or sneeze. But jog?
So, okay, there are different levels of what we call incontinence. And the one that I'm describing is stress urinary incontinence, meaning with stress, anything that increases intra-abdominal pressure, you'll have a leak, okay? Once it surpasses a certain level, then now we have to investigate further, or the degree of laxity, muscle laxity, is a lot more than we expect, okay? The normal should just be a little stress, a little sneeze, a little cough, but if it's completely affecting quality of life, then we need to investigate further. Already with a cough and sneeze, it's affecting quality of life.
Course.
Yeah.
Yes.
But once it's you cannot jog or you cannot, you
go to the gym, do anything
then now
like that.
Yes. But it's still the same thing because it's stress. The jog is creating pressure as you run, so it's leaking. The gym, obviously, you're lifting, you're pushing those muscles, it's pressing. Yeah. So this is what we call stress. Stress urinary incontinence.
Wow, okay. Let me go to the second poll. I said, let's be honest. Has intimacy become uncomfortable or painful since turning 40? We had a very healthy 35% of a little. And then there's those ones who said, girl. That was 30. And then not for me was a healthy 40. So tell me why this happens, why the discomfort?
So discomfort will come, okay? Why? Is because as women, we have estrogen, okay? And we all know this. But unfortunately, we reach around 40, and our estrogen starts dipping, and that means we are approaching menopause, okay? Estrogen has receptors in almost every single part of our body, and maybe that's what we don't know. Your skin, your organs, all these things, yes, okay? And as it starts dipping, we start seeing effects affects everywhere. That's why you'll see, if you ask also, are you experiencing dryness?
Yes.
Is your body a bit extra dry? Do you need to lather yourself a bit more? Yes, that's also due to estrogen.
That's estrogen.
That's also estrogen.
Okay, you see, this is where we're not doctors, because in my head, I was like, estrogen is surrounded here.
Yeah.
Yes.
No. So sometimes we'll have women come because of dryness, and when you investigate further, it's dryness everywhere. So the same dryness you're feeling on your skin is also now responsible for lubrication within the vaginal walls. Okay, so the reduction of estrogen reduces lubrication.
Okay.
And once we reduce the lubrication, then we start feeling uncomfortable.
Little uncomfortable.
Yeah, it starts getting, a little painful to say, you just start noticing a difference, and that's all because our estrogen is reducing and we are approaching menopause or are past menopause.
Oh, past menopause. Okay, I didn't even know estrogen, Yes, you're right. I'm that person now. Yes, copious amounts. Which brings me to the final poll. And this is not the last thing I'm going to ask any of you, but the final poll was, now, have you ever wondered if what you're experiencing is perimenopause, menopause, or it's just life? Ni maisha tu. So, and I love my audience. A healthy 40%, they said things happen after 40. I said perimenopause, a very healthy percent also said perimenopause. And then there's the ones who said babies. I had babies.
It's because I delivered.
That's it. So tell me, the ones who said things happen after 40. Yes, because that was a healthy response. It was like, and then the ones of girl.
I guess this is when you'll start at the age of 40 or approaching that. That's when you'll start experiencing these things a bit more. Sometimes they can't start earlier. So it's not that there's an arbitrary age or there's a cutoff at 40.
I
know. It's just an age that we've decided to use.
Yes.
So at that time, it could be anything. It could be perimenopause that you're experiencing. So you're starting to feel a bit hot flashes here and there, a little dryness, but not too much, and now things start to escalate as you go, and it's a gradual decline. So symptoms start to get worse as we go. Yeah. So it could be a combination of perimenopause and menopause, but what you need to know are the definitions of these things so that you're able to directly identify, am I in perimenopause? Am I in menopause? Is it just life going?
Okay. What I would like to do at this point is ask you to comment below, because one of the things Dr. Natasha is very clear is that she knows there's a solution. All is not lost. And it's the reason I was invited. And then because I was invited, I brought you along. And when we come back, she is going to take me through the MonaLisa. Exclusively available at Vivace.
Exclusively available at Vivace.
So go get a glass of water, come back. Or wine. Or wine.